Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back, everyone, to the podcast. Last week, we discussed why good fats matter. And now we're going to dive into this week's episode. I have a special guest here, Greg Elliot. He is an osteopathic practitioner, kinesiologist, and exercise physiologist who has worked with various hospitals, universities, clinics, fitness facilities, and sports teams in Canada and the U.S. He completed his Master's of Science in Exercise Science at Bloomsburg, University of Pennsylvania, and his diploma in osteopathic manual practice from the Canadian School of Osteopathy. Greg is certified in clinical exercise physiology by the American College of Sports Medicine and a member of British Columbia Association of Kinesiologists. He is passionate about teaching and learning about the latest improvements in the field of exercise science, rehabilitation, healthspan, and longevity. He continuously works with individuals at all physical levels, from people suffering from various chronic conditions and illnesses to the highest level athletes, including teams in the NHL, NFL, and CFL. He also co-founded HealthQB, a health tech platform that leverages data from smartwatches and wearables to help determine their specific health focus areas they need to address to improve health and manage stress. He is an HRV, we're going to call him an expert, and I'm excited for him to be here today. So welcome to the podcast, Greg.
Yes, thank you very much. Excited to be here. No, this is a great time to talk about HRV as everyone's getting into these smart watches and wearables.
Yeah, awesome. Well, before we dive into that good stuff, talk about, your background or your bio is very, you have a lot of education, but really, how did you get into what you're doing? Like, more about why you have this app and doing what you do.
Yeah, so I've always had a big passion in regards to health and well-being, and the population I suffered, as most athletes do, through a lot of pain issues, and they weren't getting solved. And so I was always very curious as to why they weren't, and that led me down the path of exercise science and osteopathy. And then during my time in schooling, I did a lot of work in regards to validating non-invasive technologies. My master's thesis was on non-invasive ways of measuring heart function, specifically during exercise, and validating different types of technology. So it's always been kind of at the forefront for me. And one of the things that really stuck out when I was doing my research and when I came back home to Vancouver, that a lot of people were utilizing heart rate variability. And I was introduced to it a little bit during my thesis and as my master's degree, but didn't really know much about it, and started to dive in a little bit more, and became such a powerful behavior change tool for me and my patients.
Yeah. Awesome. Well, I love it. So before we talk, about HRV specifically, I think the reason why we look at heart rate variability is for stress resilience. So what is stress resilience?
Yes, stress resilience to me is kind of the foundation of what makes someone healthy, our ability to maintain a stable environment. I find that people are the healthiest is when their body, in the presence of a stress, does not create a lot of change. You're able to maintain a lot of stability. How do we know that someone's getting more fit? Is the fact that if we put them on a treadmill in 3 months, that the exact same intensity that they go at is lower. The fact that we can take on more things and not have it disrupt our sleep or increase our blood pressure, or our blood glucose doesn't go crazy when we have a little bit of sugar in our diet. So to me, it's stress resilience is such an important factor to what makes someone healthy. It's kind of that quantified metric of that to determine like overall health, not just physical, but emotional, spiritual, and social.
Okay. So let's go one step further. So then the HRV, or the heart rate variability, is, something that you said when we first signed on here. You said, it's becoming very popular, and back in the day, like, not very many people knew about it. So what is heart rate variability?
Well, when most people hear it, they think of heart rate, like 60 beats per minute, 90 beats per minute.
Right.
And so that's what first thing comes to mind. But it's actually, what we look at is actually the frequency of which those beats occur. So me and my patient can have the same resting heart rate at 60 beats per minute, where mine beats at a metronome, super consistent on the second every second, where my patient will have a nice variable heart rate where it goes up, it speeds up and slows down, a nice kind of rhythmic pattern. What we know now is that that person, my patient, is in a healthier, happier, more well state than I am, which again, very counterintuitive because we think of health overall. Again, we think of homeostasis. We think of a nice, stable type of environment. But that doesn't necessarily seem to be the case with heart rate variability. It is the opposite. And we can get into some of the mechanisms as to why. But what we see is that to be a healthier person, both physically, emotionally, mentally, that we want more variability of our heart rate.
Got it. So how can wearing a wearable device improve our stress resilience?
So you get, from wearables, you get the feedback of heart rate variability. Before, not a lot of the wearable devices would measure it. They would have a tough time even just getting heart rate correct. So getting heart rate variability being so specific was very difficult. Now, the technology has advanced to where we can get pretty close to what an ECG would provide, a gold standard assessment of our heart rate variability and heart rhythms in general. And so one of the things that wearables can do is gives you the feedback as to looking at your heart rate variability. Where are you comparatively to your age, your sex, your demographics? You can be able to determine, are you in a kind of normal state comparatively to what's going on? So that's one thing. The second thing, biggest by far, is that it creates awareness around where your health is currently at and what you can possibly do. That is a big thing to help to make the proper decisions in regards to behavior changes. Am I on the right diet? Am I doing the right type of exercise? If I change my sleep, is it doing a lot for me? So this gives that feedback that my behaviors are the correct ones.
I have two wearables. I have an Oura Ring and I have the Apple Watch. And I've noticed, and I could probably talk about, I could be a patient for you with my heart rate variability. It's a hot mess right now. But I've noticed that my Oura is different than my Apple. So why are there differences in the wearables and measuring the HRV?
Yeah, it was probably more the Wild West, probably 5 years ago, where a lot of the companies would come up with their algorithms where they would say this is your heart rate variability, you throw out a number, and they wouldn't necessarily give you a statistic. Now it's pretty standard that majority of wearables are out there. They now measure HRV as one specific statistic, and they calculate it typically through the nighttime, and they kind of show you your average in the morning. If you want to look it up and you're interested in that side of things, the biometric or the number, the statistic that's associated with HRV is called the root mean square of successive differences, or RMSSD.
Okay,
Don't need to know. Yeah, you don't need to know what the equation is, but if you look at literature, that's when you look at wearables and apps, that's pretty much what they provide as that data point. Now, Apple Watch does not. They use the SDNN, which is just a different measurement. It's more for long, 24-hour readings when it regards to hospitals, to heart conditions, than it would be specifically RMSSD. So that's why typically Apple Watches have a drastically different number comparatively to most wearables that are out there. Now, if you had a Whoop or a BioStrap, any of these type of other companies that measure RMSSD, you would probably get very, very similar values.
Okay. The Oura has the RMSSD?
Yes, it does.
Okay. Now, I want to ask you a silly question. You mentioned something about the HRV overnight and in the morning. Is your heart rate variability based off the previous 24 hours, or is it literally calculated while you sleep? Can you touch back on that? Like, how is it figured out?
Yeah, the Oura Ring in particular, it's nocturnal. So it's all the data captured from the nighttime. And that's what majority of the apps do right now. They don't do a 24-hour capture.
Oh, okay.
And the reason why the limitation of the wearable products with the PPG sensors or the light-based sensors, motion artifact is a big thing. And so what they do is it's really hard to reproduce that. That's where a lot of wearables struggle sometimes, even still with heart rate being active it's a difficult biometric to kind of capture when things are in motion. So when you're sleeping, typically, obviously, there's a lot less motion happening, and so there's a lot less ability to have artifacts. And so the number that's produced in the morning is pretty much only from your nocturnal, the time you're sleeping.
But what you did during the day obviously affects the sleep. So riddle me this. How can you get an amazing sleep? And like on my wearable, like my Oura Ring's telling me I had, a 93% or whatever reading of sleep with the crown, but my heart rate variability is in the toilet. So how does that happen?
Yeah, so obviously sleep is independent of heart rate variability. You can have a very, stressful day where you're having a lot of recovery and your sleep quality is actually, quite good. There's many things that can impact overall average. One of the big things that people don't realize is eating late has a drastic impact in regards to your heart rate variability over the nighttime. And so now continuously, if your HRV is always in the toilet, and say it's a little bit lower than you would like it, you can still have good sleep.
Yeah,
you can still have high quality sleep. What that means is that if you feel that you have good quality sleep and overall typically you're doing pretty well on that side of things, you can fall asleep easy, you can stay asleep, you can wake up and relatively have energy, then the reason why your HRV is low is not sleep related.
I don't know why it's low. Well, actually, I might have a few things or a few reasons why. I on a constant quest to get it higher because I know the higher the better means you have better stress resilience, correct? So it seems silly, like you actually want it high, like your brain has to really think about that, like why do you want it high? But it goes back to what you said. It's like, oh, you have the ebbs and flows of your heart rate over the day, depending, or actually while you sleep, I guess, in this term, rather than just like a steady heart rate, correct? So for me, I totally switched up my workouts. I went from eating a lot of calories to eating intuitively. And I also have a lot of chiropractic work in the last 2 weeks. And my HRV went from, I don't know, I averaged maybe the 50s, 60s, which in my opinion, I still want to get it higher. And now it's in the 20s. And I am like, nothing, that's the only variables that have changed. So I guess the point is that I think these things are contributing because my body has been in such a routine for so long. And then I just kind of threw it a loop and gave it something different. And it's not, maybe it needs, I'm hoping that it just needs time to adapt to this. But at the same time, it's frustrating because I'm like, what can I do to make it better? And I know that I feel that the lower HRV is, affecting, long-term health because it's so low. Do you have any insight on that?
Yeah, when you change certain things that are, increasing stress, whether it's, sometimes with restrictive diets, when it comes to, increasing the exercise intensity and those type of areas, as well as even to the point of manual therapy interventions, depending on how they're geared towards, can be more sympathetically driven versus parasympathetically driven. Now, there's a lot of research around chiropractic and parasympathetic, activity in regards to the manipulations of joints. However, all of those factors come into that, and what you want to be able to see is it may be just too much all at once, right? Where you're able to alter one thing at a time, and you don't want to go, in the 50s. Honestly, is not that bad. You should be quite proud if that's the case. But I think some of the biggest revelations that I've had with patients when they come see me is they're usually pretty dialed in now with all the education around sleep, physical activity, nutrition, and honestly, they're doing 90 to 95% of the right stuff, right? They're on the right path with those things. To me, it's the other factors we call more the psychosocial factors of what's going on. I saw this a lot with COVID when we were unable to have social connections, and the amount of decreases in heart rate variability as a result was drastic for some people, individuals, because they were so lonely.
Yeah.
And we know loneliness has such an impact, right? So when people don't have instrumental support from mentors or emotional support from friends or family, and sometimes it's lacking, that can cause decreases in heart rate variability. Anything in regards to past traumas, or not dealing with stress appropriately in terms of emotional regulation, or not having purpose. One of the things that we've had great success with people that have transitioned from working life to retired life, where they think everything's fine and then their heart rate variability is very low, is we start to work on their purpose. What is their second half of their life actually what do they want to do, and start to be able to plan those things, have drastically improved heart rate variability to upwards of 50 to 75% for some individuals. Right. And so there's to me, there's the foundational stuff, which is the biological side, which is again, nutrition, the physical activity, the exercise, the sleep, the physical health, making sure blood work's all in order, like getting the basics down, things that are within your control that don't require a lot of time to change, right? Comparatively to connecting with people, comparatively to self-acceptance, or working on emotions that are a continuous, non-stop thing that's on your mind that you can ruminate and magnify and easily, because you have to constantly think about it, comparatively to taking a supplement or making some food or going for a walk. It takes a lot longer time to change those things.
Interesting. I think that's probably mine. I have all those basics down, sleep and diet and exercise and meditation and all of those things. So it's got to be, I think it's the drastic change and pivots I did in the last couple of weeks that put it in the toilet. So if someone is newer to HRV and maybe has an Oura Ring or an Apple Watch or some sort of device that tracks it, what are some basic guidelines that you want, or trends that you would like to see, that you would recommend? And then second question would be, like, if it's not where you recommend, tips that we can do to improve it to get us to that recommendation.
Yeah. So the first thing is obviously, I'll kind of go through the flow that I do with individuals, and it kind of follows something that's kind of in psychology. That's super important. So with the Oura Ring, if you're just kind of new and getting the measurements, you need to take it for a little bit. You can't just do 1 or 2 nights and think like, oh, that's what my HRV is. You need to take it for probably about 7 to 10 nights to give an idea of kind of where your average is. And that's where everything's from their algorithms and general algorithms start to be able to determine, okay, this is where you're at. From there, again, it's you start to work on the foundations of things, and it's usually the things that are relatively easier to implement. So I always say, when I do consultations around heart rate variability, when was the last time you had detailed blood work done, right? Because if someone has low heart rate variability, I've had it multiple times where people have undiagnosed diseases, right? And it's those need to be medically managed first. To be able to be addressed. There has to be on top of those things. If you're having uncontrolled diabetes, uncontrolled hypertension, like those things need to be addressed medically first if they're within the danger ranges. So that's always the first thing. Make sure that physically that your health is in order. Then you start with the foundational aspects of exercise, nutrition, and sleep. And you look at those and you start to dial in a little bit more. And it's not necessarily finding the perfect diet, but it's about changing one of those mechanisms, right? Make an alteration. I've always wanted to do this. Now, what I suggest is, for most people, don't change all of them at once, but change one of them, because it's much easier to be able to do that, right? Whether it's going for a walk, if you're sedentary, going for a walk, 30 minutes a day, or trying intermittent fasting as you've always wanted to try it, or some supplementation or change in sleep pattern, sleep hygiene type of things, and see how that goes. So start to alter with those a little bit, and you'll probably have a good pattern over the next couple months to figure out what's going on. Then from there is the framework that I see to be very helpful for people to start with, if you don't have a way to prioritize these for individuals based on assessments. It's something called Maslow's hierarchy of needs. And I think that's a great framework to be able to start, because the very base is our physiological needs, right? It is our physical health. It is our exercise, our movement, our sleep, our recovery, our regeneration. Those things are our foundation. And then we start working up the pyramid from there, which is, you talk about connection, you talk about our emotion, then you talk about self-acceptance and purpose. And so all of those things are highlighted through the needs. And to me, the reason why I like it is, again, it goes from those things that are relatively easier to be changed, whether it's taking medication, whether it's, just altering a couple things in the bedroom or make it cooler or whatever it may be, And then it starts to layer on things that take a little bit longer time, right? But you're starting with things that when you see those changes, and typically it can be quite drastic when you're working with individuals that are on my caseload, where you start making those basic alterations and start working on some of the more the psychosocial aspects of that, and making sure people feel safe, people feel heard, people feel of value. You go through the hierarchy, and then it's a great way to be able to kind of layer on that kind of a plan and a process for each individual. To me, the biggest thing is set them up for success.
Oh, awesome. So you talked a little bit about that and like tips that we can do to improve. So what are, besides eating late at night, what would be, I guess, some other factors that can really affect your HRV in a negative way?
Yeah, biggest thing is alcohol. I think, well, it's funny because it's people know it's not good. Not even start monitoring it, do you realize how bad it actually is? I think that was one of the biggest realizations. I have a story of a fibromyalgia patient that was using pain to cope, or using alcohol to cope with her pain. And she goes, I know it's not good, but it helps me get through it, right? 15 years of suffering from this thing, not getting anywhere, medication's not working, going through all these programs and things like that. And I just put a wearable on her. And to me, honestly, the biggest intervention, and I said this at the beginning, it was the awareness.
Yeah.
Had nothing to do with what I said, had nothing to do with anything, my demeanor or our relationship, nothing like that. It was just her objective understanding of what alcohol does to her system.
Yeah.
It has now been almost exactly a year since her last drop of alcohol. She's able to better manage her fibromyalgia, has halved her pain medication the last time I talked to her, which is 6 months ago. But looking at her data, we still have access to her data, which she's completely okay with. I can tell that she hasn't had, because we don't see those gigantic drops in HRV that is super obvious when she has any alcohol whatsoever.
What does alcohol do? Because you think it's a calming, right? So how does it, from a chemistry standpoint, I guess, or biological, like how does it affect the heart rate to that extent that it messes up the HRV?
Yeah, well, it's just, again, it's to the point of what the body is trying to be able to do to break it down, right? It understands that it's a toxin, and it's like, oh, we have to do everything to get rid of this. And so it dedicates all of its resources in order to deal with that. So everything that's going on in your body, it ignores. It doesn't necessarily get you into a good quality sleep. It doesn't get you into this rest and digest state, because it's trying to be able to deal with the stuff that you just put into your body that takes a long time to process and deal with. So that's where HRV is such an important biofeedback, is the fact that it lets you know when there's something going on to your body that your body's having to deal with, more than saying, hey, I'm in a harmonious, healthy state and I can attack anything that's coming at my way. Very agile, adaptable, which is that variability where if I'm having to deal with something, whether it's intrusive thoughts, whether it's a chronic disease, whether it's anything of that nature, poor dietary habits, it's got to go deal with that. And it lets you know of saying, hey, the body's dealing with something else. I'm just trying to maintain, I'm just trying to survive right now and not thrive.
Kind of along the same lines as why you shouldn't eat that, food before bed, right? Because your digestion's going crazy and your body's not able to do the other things it's supposed to do, because it's like trying to digest your food, right?
Absolutely. And it's typically the rule that I've seen from majority of people. If you can get away with about 2 hours, but majority of people, it's about 3 hours before bed seems to be the gold standard for majority of people, just purely based on, there's many different recommendations based upon that. But this is purely from the objective data standpoint that I see, is that seems to be the magic window for most people. Yeah,
I've experimented with that myself, and it's like, oh yeah, I know if I eat, you go to a function and you don't eat till late, I'm like, this is going to totally affect my sleep, for one, and then two, my readiness level is not going to be good. And then also I had a conversation this week with the patient about that too, because she says, I just want to wake up and feel rested. And so she has Aura, and I looked at her app and I said, you know what, I want you to pay attention to what you eat the night before when you have, a poor reading, because hers is like yo-yo. Sometimes she's good. It's all over the place. And I said, there's some patterns in your life that I think you need to be aware of that are contributing to your poor sleep, that's therefore making you not feel well the next day. And I said, I think you just need to track it and look at it. And I'm pretty sure it's what she's eating at bed. Or she also likes alcohol. So I said, I want you to pay attention to the nights that you drink alcohol and how you feel the next day. And I think you might start to see some trends. So that's why I love wearables. They can kind of get into your head a little bit, because here I am like freaking out. Like, why is my HRV so low? And it's, causes more stress, which I know is not helping the situation. But at the same time, they can teach you so much about your life. And even I've had the Aura for a little over a year. And a few months ago, I had like my whole day flipped upside down with having to take my mom to the hospital. And that used to cause me a bunch of it would have caused me a bunch of stress, like internally, where I would have been like freaked out about it. And yeah, it wasn't ideal, but I woke up the next day from having a 12, 14-hour day, totally had to, clear my schedule, et cetera. And I woke up and my readings were really good. And I was like, that's my body, like learned how to adapt to that pivot, because I've trained it and I've realized this. And I also was aware of it too. So I thought that was really neat.
Yeah. Absolutely. The big thing, again, awareness, right? Knowing the fact of like, hey, if your HRV is low that day compared to its normal, hey, maybe I need to prioritize recovery, making sure to eat a little bit better and maybe not exercise as hard, kind of doing things to promote recovery and regeneration, then to be able to say, hey, heads forward, I can, take on the day and whatever comes my way, I'm good to go.
One, I didn't put this in your question, so if you can't answer it, let me know. But I help a lot of women in hormones and menstrual cycles, and I know that HRV can be in women sensitive throughout the cycle. Can you touch on how it changes throughout the cycle and why?
Yeah, it's interesting. It's early on I saw some of this, and it's not necessarily the case for everybody, and so it's very much an individual approach when it comes to the cycles. And I think it really follows, to me, the symptomology that people experience. So if you have someone that has a significant amount of symptoms when it comes to the menstrual cycle, I see HRV to be a great feedback mechanism in regards to that aspect of it all. But I found people that don't have a lot of symptoms, you don't necessarily see those big ebbs and flows in regards to the menstrual cycle that we see. But actually, I'm more curious is I don't deal with the hormone health as much. What have you seen a little bit more around people's HRV and their cycle?
Well, Aura just came out with the update for that for the menstruating women, and it's going to give you more insight on the phases. So typically lower on your last half of the cycle as you're leading up to menstruation. Personally, like for me, I don't have, like you just said, I don't have very many symptoms because I've balanced the hormones. So I don't really see that variation, but it's definitely something I've been looking at over the last couple of months with mine and charting it out more on an actual calendar to see. But yeah, I haven't dived into it too much with many patients. Not that many people have, wearables that track it like that either.
No, and that's the big thing. I've had a few, and primarily our naturopath. If there's anything in regards to menstrual, she's very familiar in the wearable space as well, which is phenomenal, and we're able to tag that way. But yeah, you're typically right where you see such a decrease at the end of the last half of the cycle from there. But I really find it's really big in regards to the symptomology. And you start to see that. If you start to see those downs, to me, it's an automatic referral. Like, yeah, you're going to our naturopath because that's she's the one that's able to help you the most in that area.
Oh, that's awesome. Tell me a little bit about your app, the Health QB, and like, can anyone have that app, or do you have to be a client of yours?
No. So what we're doing is we're making it accessible to as many people with wearables as we possibly can. So we started with a company called BioStrap. They're out of Austin, Texas. They're B2B kind of business to business wearable product. But we integrated with them. We integrated with Oura Ring. We've integrated with Fitbit, and we're kind of going through all the wearables and adding them all in. And essentially what it is we're trying to be able to provide some direction of your health and well-being, and taking data from your wearables, asking some lifestyle factor questions to say what area of your health is, the low-hanging fruit. Are we, do we need to be able to address sleep more than our emotional regulation? Do we need to be able to connect more with people and have more emotional support? Then we need to focus on our physical activity and exercise, because all those areas are important. right? And to me, depending on the person, one may not be more important than the other. And so to me, it's that like I want some sort of direction of, especially with my caseload of people with more functional illnesses and more the invisible type of illnesses that are really comprise the biopsychosocial model of care. And I want to make sure that, I have certain skills. I want to make sure they're in the right room. I'm dealing with the right thing at the right time. We have health coaches, clinical counselors, medical doctors, different people in different areas to kind of help with this individual at the right time. And so what our app does is help the individual as well as the practitioners determine from a holistic perspective, if we're looking purely objectively, what area of health and well-being needs to be addressed the most, and then be able to work on that specific area. And where does your type of intervention or interventions that you deal with, where does it sit in regard to the pecking order? So really you see that, you kind of put that with Maslow's hierarchy of needs and also the values and the goals of the patient. You kind of put all those things together to kind of come out with a treatment plan for that individual and determine the progress from there.
Really cool. I love that. I'll have to check it out. Awesome. Greg, this has been amazing. I probably could ask you a trillion more questions about it because it's just fascinating. We'll have to maybe get you back on to share some more case studies. I think those are fun for patients to hear, like the fibromyalgia lady. That's awesome. But yeah, it's a hot topic and, something that's becoming more and more, mainstream and it's harmless, right? And most of the devices do have airplane mode. I put my airplane mode on my Oura Ring every night just to, limit the EMF stuff and all of that. But I really appreciate you being on here. I'm going to ask you one last question I ask all my guests. What would be your best or favorite health tip that you can share with the audience?
Yeah, I was thinking about this one from there. And honestly, when you start to look at the state of the world that it is now, I always ask the question is like, what does it mean to you to be healthy? I ask any employee that we have, any type of person, and they all have different answers into what health means to them, right? It's waking up with energy. It's, connecting with friends and family. I had that answer before. I've had many different areas. And it's finding out kind of like, what do you envision health being? Right? For you, how do you want to live your life when you're 80? Right? Do you want to climb Mount Everest or you just want to be able to have good times with your friends?
Right.
Whatever health means to you, be able to kind of define that, determine that, and then drive all your interventions and your focus towards what that is. Because that's super important. You don't want to be doing a bunch of things for a long period of time that you don't want to be able to do.
Absolutely.
We're on this earth for a very short period of time and focus on, what makes you happy. And be able to live a very fulfilled life.
Oh, I love that. That's really good advice. Thank you for sharing. Is there anything else that we missed or that you wanted to let people know?
No, I think the biggest thing is if you aren't tracking HRV, there's, all the wearables now pretty much track it. There's free apps that are out there to be able to track it if need be, but it's a great feedback mechanism to determine behavior change. And I'd always say this, don't look at it too much. Right. It's good information, but take breaks from it, relax, enjoy, take some breaks from it from there. But I think it's a great feedback tool for individuals that are looking to optimize their health and well-being.
Absolutely. Well, we'll make sure we have the link to your app, the Health QB, in the show notes and ways that you can find Greg. But again, thank you so much for being here today.
Yes, and thank you so much. I know podcasting is a lot of time, it's a lot of effort, but it's the people like you that make a real difference of getting messages out for people to really take ownership of their health and well-being, developing health agency. So thank you very much.
Oh, you're so welcome. I appreciate that. And we'll see everyone again next week.